Three things I avoid as a brain doctor and pain doctor. Number one, I would never let a chiropractor touch my neck. And the reason for that is basically that in the neck you have two very important blood vessels. One of them is called the vertebral artery, the other one is called the carotid. And these are basically the main source of blood supply to your brain. Now, what can happen in chiropractic neck manipulation, specifically neck cracking or HVLA, high velocity, low amplitude manipulation, that can potentially lead to dissection in those vessels. So that's a tear inside the blood vessel. And when that happens, basically you can get a stroke. So simply not worth the risk. There's safer options like physical therapy, massages, acupuncture. Number two, deadlifting. Deadlifting is probably the exercise that's the most highly associated with back injury. And the reason for that is that you're putting a lot of pressure on those L5 and S1 vertebra. Whenever you're doing the deadlift, you're putting a lot of pressure on that disc, and that basically puts you at risk for disc herniation and compression of the nerve roots, right? So sciatica-like pain. And there's safer options like squats and other things you can do at the gym. And then the third thing I would never do is wait when I have new neurological symptoms. So if I have any numbness or weakness in an arm or changes in vision or changes in speech, so that's one of the biggest mistakes you can make is to wait for the symptoms to go away. The danger in that is that you'd be missing on the 4.5 golden window that we have to administer clot busting medications if that were a stroke. Go as soon as possible because time is brain.